I'm Angelica Sadar, the Executive Director for NRBS. Welcome to today's lecture. It is sponsored by iMediSync, one of our sponsors. To their website will be in the chat. And this presentation will be recorded, and we urge you to share it with colleagues that couldn't be present today. I have a few announcements before I introduce our presenters, Dr. Linda Thompson and Andrea Reach. So announcements real quick. I want to remind you of First Tuesdays. That's a drop-in thing. Next one is December 3rd. It's just a drop-in chat about what you want. We always have a BCIA approved mentor there to answer questions if you have technical questions. This is the last of the webinar sponsor series for this year. We will begin again in January, and that one will be offered by BMedic. So stay tuned for that. I want to remind you of the podcast, Healthy Brain, Happy Body with Saul Rosenthal, one of the NRBS board members. We will put the link in the chat as well for that. Lots of good stuff showing up on there. And please like it so that we can get the word out about our profession. Like it. Saul's going to put in what you're supposed to do. You do more than like it. Questions for today on the lecture. I'm going to ask you to put them in the chat, and we will address them with our presenters at the end. And before I introduce our presenters, I want to hand it over to one of the Rebecca Walkers that are here. There's like 5 Rebecca Walkers. And the reason for that is I think that represents the strong support that we get from iMediSync. She's not, are they quintuplets or something, quadruplets? But anyway, we have a strong support from iMediSync. So take it over, Rebecca and Cody, and then I'll introduce our presenter.
Awesome. Thank you, Angelica. It feels like a good day to be me today. I just wanted to announce that our Black Friday deal for iMediSync with our iSyncwave, which is what was used for the case studies that will be presented on today. We're giving away a free tablet, free electrodes, free welcome kit, and a general discount for the order. We are offering 0% financing for 12 months with no interest for a year. And we can also put in the comments a link if you want to meet one-on-one with us to go over any questions. We'd be happy to talk with you. And I'll turn it back over to you, Angelica, to introduce our speakers.
Thank you. Okay, so let's begin with Dr. Linda Thompson. Man, we're lucky to have her and delighted to have her here today to share some of her vast knowledge. Dr. Thompson will be presenting along with Andrea Reach on autism, ADHD, and near-infrared light therapy. I am unable to include all her accomplishments in such a short introduction and apologize that it's hard to capture what a true leader and great colleague she is to so many of us. Dr. Thompson and her husband, Michael, have been longtime supporters of NRBS, and we are honored to have her here. She's a registered psychologist with vast experience in teaching, clinical psychology, school psychology, and is the director and owner of the Learning Centers. She's been the executive director of the ADD Center since 1993, and that's the largest center in Canada using biofeedback and neurofeedback for ADD. Her doctoral dissertation she's only 45 years old, but she finished her dissertation in 1979, and that dealt with self-esteem in hyperactive children. She's a well-published author of many books and articles. She's the co-author with pediatrician William Sears of the ADD book, New Understandings, New Approaches to Parenting Your Child. She's authored Setting Up for Clinical Success, published by BFE, and along with Dr. Michael Thompson, she has co-authored the basic textbook in this area of professional work, the neurofeedback book. If you don't have it, get it. It's a must-read, an introduction to the basic concepts in applied psychophysiology. There's more. Just go to her website. There's lots more. She's the co-recipient with Dr. Michael Thompson of the Lifetime Achievement Award from BFE, Distinguished Scientist Award from AAPB, and awarded fellow status with ISNR and AAPB. She's got a great family. I could go on and on and on. I'm going to move over to Andrea Lee Chung. She's a psychologist registered with the College of Psychologists in Ontario. For those of you that aren't in Canada, it's very different than the United States, but that's a good registration to have. She's been an integral part of the ADD Center and Biofeedback Institute of Toronto in Ontario for over a decade now. As the clinical director, she's involved in treatment planning. She uses neurofeedback, biofeedback, Loretta neurofeedback, and does staff training. She is an author, first author on paper investigating the effects of HRV on sensory motor rhythm, and co-author on other publications in neurofeedback. Please join me in welcoming them now as I hand over the presentation. Ladies, take it away.
Thanks so much, Angelica. So Andrea is really going to carry most of the load today, but I'm just going to begin by telling you a little bit about how we operate at our ADD Center, which we also call the AD Center, because we're adding to people's self-regulation skills. It's all about self-regulating attention, self-regulating emotions. And we feel that adding photobiomodulation to the list is important. So we'll tell you a bit first about how we assess, because if you want to have success in this field, you have to begin with a comprehensive assessment. So our assessment includes, of course, some quantitative EEG. And sometimes we just do single channel. If we feel that we can get enough information from that single channel, going back to Lubar's work with ADHD, for example, that's what we do. But if we need more information, then we use a 19 channel. And since we've had the iMediSync equipment, we do that. We actually do 3 different recordings for 19 channel on 3 different instruments so that we can triangulate our findings. And it's rather interesting to see when they line up and when there are differences. So, of course, the iMediSync has a database that's the first one to separate males and females, and it's got a lot of children as well as adults. So it's interesting to have that Korean database in use. The other things that we do besides those, of course, the EEG measures are continuous performance tests. And we use both the IVA 2, that's both visual and auditory, and the TOVA, the test of variables of attention. So again, we've got 2 ways of looking at how they do on a continuous performance test, which is helpful not just for ADHD, but also anyone. For example, that person with anxiety, they often do well on these tests because performance anxiety improves their scores. We use the CNS vital signs for a neurocognitive test battery, and it has a 3rd continuous performance test in it. And it also tells us about things like verbal and visual memory, and it has a digit span in it for processing speed. So it has a lot of things, coding rather, for processing speed. So it's a good measure, and it's nice because we use everything pre-post. Psychologists like to measure things. So we measure at the beginning when we do an assessment. If the person does training with us, typically 40 sessions of training, then we do the same tests at the end, and we have the pre-post comparisons. So the slides that you've missed have just been a list of the tests that we've used. So quantitative EEG, continuous performance tests, and then the CNS vital signs for neurocognitive tests. The other thing that we always do is draw a person. And I call draw a person my low-tech, high-yield test because it tells you about the person's emotional functioning. And you will see changes when they do a drawing after 40 sessions. Typically, the changes will be in more details because their attention is improved, and especially the eyes. The eyes are the windows to the soul. So try that, draw a person. Here it just says DAP at the bottom. And of course, we use questionnaires. So we have different sets of questionnaires for children and for adults. And there is balance testing when we do the 19-channel quantitative EEG. We use an iMediSync, similar, the same name actually as the photobiomodulation that we use, but it's a company in Germany. And of course, there's the interview. And what's the most important thing with an interview? Listening. I have this saying always in my head. They have to know that you care before they care what you know. So I always say, don't get so caught up in your fancy equipment that you forget the person sitting in front of you. Something that Sue Wilson said years ago in her work with athletes. Okay, so that's it for our standard assessment. So I want you to see where the iMediSync fits in there. We review all the data to make decisions about the training. And as I've said before, we'll just use single channel training if it's a straightforward case. And we use, Loretta Z-score training if it's going to be complicated. We always combine our neurofeedback with biofeedback, and we've done that since we began. And we continue to do that. But now, in addition to biofeedback, we'll sometimes use transcranial direct current stimulation, which we've used for a number of years, at least 15 years, and also now the photobiomodulation. And all our programs are combined with metacognitive strategies, which just means learning how to learn. Like metacognition is what you know about what you know and what you understand about how you learned that. So metacognitive strategies are also combined because your neurofeedback takes some time to work. But the metacognitive strategies are things they can apply immediately to their schoolwork, or perhaps it's an adult who needs better time management or procrastination or other issues. So metacognitive strategies have also been part of our program since the beginning, reflecting probably my background in school psychology and owning learning centers. It just helps generalize what they're learning in the session to everyday life. I call it the value added. And now Andrea is going to take over about this because Andrea is the one who spearheaded our use of the near-infrared light therapy, the photobiomodulation.
So we're excited today to talk about how we're integrating the near-infrared light therapy using the iSyncwave into our traditional neurofeedback practice. And just as we've been working traditionally on a comprehensive assessment and how it leads to intervention, we make sure that we're doing a comprehensive assessment prior to incorporating the near-infrared light therapy into our neurofeedback training programs. So today we're going to discuss 4 cases and how we've been integrating the PBM or near-infrared light into the training programs. So case 1, we'll be looking at an adult male whose chief complaints include inattention and inefficiency at work and difficulties managing stress. Case 2 is a complicated case, a 10-year-old boy with ADHD, as well as ASD and a gifted designation. Case 3 is a 12-year-old girl with ADHD and ASD, but with a low IQ. And case 4 is an adult female with attentional difficulties and anxiety and working towards optimizing performance. So we'll talk about how we've added the near-infrared therapy into each case, starting with case 1. So for this case, the adult male with ADHD-type symptoms working to improve efficiency at work, we started with our traditional program where we were alternating between single-channel training at CZ because he did have that high theta to beta ratio, as well as some excess high beta. So working on training those in the right direction combined with heart rate variability. And we were alternating that with our Loretta neurofeedback. So 1 session per week of the Loretta neurofeedback targeting networks associated with attention, executive function, as well as the single channel and strategies to help improve his workplace efficiency. And the plan was to do a total of 40 sessions, which is our usual program for neurofeedback training, because we know that that leads to lasting change. And now we worked on integrating his program with the near-infrared light. We just started using it as he was coming up towards the 30-something sessions of training. And what we did was we added in 10 minutes of the near-infrared light prior to each session. And that's how we've been integrating the light therapy for most of our clients, and trying to do it at least 2 sessions a week to 3 sessions per week. We did sessions at 12 hertz at the beginning, 2 sessions of 12 hertz. And then he really wanted to increase his alertness, and we worked on 10 sessions with 14 hertz. With an aim to really optimize his performance. So he had a total of 12 sessions of near-infrared light therapy. We did an iSyncwave, iSync brain map, which is by iMediSync. And you can see the before and after just of the light therapy. So this is just before and after the 12 sessions at the end of light therapy. And what we could see was an improvement in his theta-beta ratios, as well as an improvement in his alpha-2. We also looked at the ratios and compared them before and after training, and it's quite obvious to see the improvements there in the theta-beta ratios before and after training with the eyes open. And this is again from iMediSync. There was also on the eyes closed recording, you could see a high theta to beta ratio at the left frontal, and that also resolved following the 12 sessions of PBM. As we were working through the reports, there's a lot of data that can be collected and used in iMediSync. And we have here a brain activity analysis, and this one indicates red if something is underactive, meaning the theta to beta ratio is elevated. And you can see that before his light therapy, we had elevations in theta to beta ratios at multiple locations in the brain. And following the therapy, it's completely in the balanced range. And these are really nice visuals to kind of quickly look at improvements following the training. We also looked at the brain activity analysis mapping area to function. So here it breaks down the different lobes of the brain and looks at percentile ranks based on the theta to beta ratio. And the only one for him that was significantly below the average range was in the temporal lobe. However, they were all on the lower side of the average range. And if you look carefully, I know it's a little small on the slides, the percentages have, almost all of them have improved with the training, moving that theta to beta ratio in the right direction. There is also findings on brain aging that you can pull from the iMediSync database. And what we can see here is that his results on the before training were more in the underactive range. And following training, they were moving more towards the center here of the normal distribution. So things are looking improved on this mapping as well. Linda spoke about a test that we do at the beginning called a continuous performance test. This is one of the continuous performance tests that we use called the TOVA test, or the test of variables of attention. And you can see on the standardized testing, his attention comparison score has improved from a -2, looking more similar to the ADHD sample, and is now looking closer to 0, where scores below 0 would indicate, I don't know how to go back, less symptoms of ADHD. So we saw an improvement in mostly drifting attention or variability of response. We also looked at heart rate variability, and this is his pre-data related to heart rate variability. And what we were interested in seeing here is that his heart rate was in the average range, but his heart rate variability, or the change in his heart rate, was more in the sympathetic side. So we can see it wasn't very balanced. It was more in the very low frequency, and his SDNN was a little bit low. Following the training, and this is following the full program of 40 sessions, including the light therapy, we can see a much more balanced picture, and he reflected feeling calmer. We also looked at event-related potentials. We like a lot of data. So here we looked at brain speed before and after training. And you can see that the P300A here, related to attention, that's measured at CZ, was outside of the green window, which is the normative range. So looking a little bit slow compared to his age. And also the P300B, which is related to information processing, was also slow compared to the average for his age group. The interesting finding here was that the brain speed actually improved and was closer to that average range for both attention and information processing. And as he had mentioned, feeling overwhelmed and having difficulties with attention, this fits with what we were hoping to improve for him.
Now, remember that these measures are done with a different instrument. Right. This isn't from iMediSync. This is from Evoke Neuroscience.
Mm-hmm.
But ERPs are very highly respected. You can't fudge them. So, yes, this is quite a significant finding. And this is before and after the 40 sessions, not just before the 12 sessions of light therapy.
Right. So the most important thing is, does the client feel that they've achieved their goals? When checking in with the client following, we always ask them if they feel they've met their goals, and he felt that he had greater efficiency with respect to work, and he was feeling less stressed and less overwhelmed. Case 2, our second case is, as mentioned before, a complex case with autism spectrum disorder, ADHD, and a high IQ, and in fact, a gifted child. He had done a set of 40 sessions of single-channel neurofeedback. He was not able to tolerate doing something like a 19-channel at the beginning, and he showed excellent improvements, but then we had a setback due to some issues that happened at school. And he became very aggressive with the staff and difficulties with aggression at school. So we wanted to work on something that would really help to calm his nervous system. And we did a brief 8-minute brain map. And we were able to do an iSyncwave brain map and add the PBM, or the near-infrared light, to his program to help calm him down. So we started off with 9 hertz for 5 minutes, followed by 10 hertz for 5 minutes, because he had a deficit in alpha in his brain map. And then he continued to do 12 hertz for 10 minutes to really calm and kind of stabilize him, was the plan. He did a total of 22 sessions of PBM. And again, we combined it with his single channel training. So he would do 10 minutes of the near-infrared ahead of his single channel training program, which also combined the heart rate variability.
And single channel was done on a different instrument.
That's right. Yes. So this is his some of his results from before and after the training. Before training, before the PBM, I mean, he had eyes closed there. You can see that it's quite a low amplitude EEG. And post, we can see elevations in the overall amplitude there, which was good. He had difficulties sitting still. And so there's a little bit of excess activity there. This is from the pediatric report from iMediSync. And it shows frontal lobe functioning, so frontal lobe development graph based on a theta to beta ratio. So this was interesting to take a look at, that his theta to beta ratio came down. So you can see the green dot kind of going up towards a lower theta to beta ratio following the training. There's also an information processing speed graph here. And we can see that following the light therapy sessions, and it's a little grayed out here just because of the copying, but it was at 7.8 hertz was his peak frequency alpha before, and after it's looking like 8.2. So it's still a little bit on the lower side, but we can see that it's moving in the right direction. We also have alpha wave reactivity in that pediatric report. And what it really shows overall here is that there's increased alpha, both with eyes open and eyes closed. And because he's a difficult case, sometimes there can be a little bit of artifact in there. There's also an analysis that's available called your proportion of alpha waves. And so here you can see the proportion of alpha waves for this client was at 14% with eyes closed before, so fairly low compared to the normal. And then following the light therapy, it's up at 21. So it's really increased the amount of alpha produced. And same with eyes open, 11% to 20%. The ratio hasn't changed as much. And the note here just says that the alpha wave reactivity analysis had showed before that it was lower relaxation capacity, which matched with he was, feeling quite aggressive and not calm at all. And now he's looking calmer. Your alpha wave reactivity analysis results consistently position within the average range. The iMediSync report also provides a connectivity analysis that's kind of a quick look at it. And it was showing also that weak connectivity before training and the more balanced look at it after. So that's the weak and then the more balanced here with the hemispheres. The iMediSync also provides a brain development or brain age based on believed theta to beta ratios. And his brain age is looking more similar to his own age after he completed the training. So it was at the 7.4 years of age and now up to 10, where he is 10 years old at this point. We also did our standard TOVA test with him. And although you can see there's still some room for improvement here as far as his attention goes, the continuous performance test shows this attention comparison score here, which started with a -5, where he had difficulties with reaction time variability or drifting attention. He had a slower response speed and some inattention. And following training, he's looking a little bit better as far as his reaction time in the variability in the second half and his attention. Still a little impulsive when he gets started. So still some room for improvement there. When he started the training, he was not able to get on the scoreboard with the test called the IVA. So the IVA is the Integrated Visual and Auditory Continuous Performance Test. On this test, the client is asked to click the mouse if they see or hear the number 1 and not if they see or hear the number 2. And so they're asked to pay attention. And here it provides an attention quotient and a response control quotient. And the response control is a measure of impulse control. So his scores on the first test were well below the first percentile and not on the scoreboard at all, which comes up as invalid.
If you miss more than half the items, then it's invalid.
Mm-hmm.
So he was highly inattentive.
Mm-hmm. And the most recent IVA test that we've done on him shows that his attention quotient is now at 66. Those are standard scores. So a score of 100 would be considered mid-average for his age. So he's still a little below the average range there at 66, but now he's on the scoreboard, and his visual attention has really improved to an 88. And response control as well is now at a 69, so just below the average range there.
He was fast, but he sacrificed accuracy for speed. You can see the red is his speed, the gold on the right is his prudence, being careful not to hit non-targets. But the visual attention in particular is looking good now. And it's very typical of those with who are on the spectrum, whether true autistics or the Asperger's type, which is what he would have been with his gifted IQ. They'll tend to respond more to one modality than the other. In his case, it was the visual. So his visual vigilance there, so catching the targets, is at a 101, whereas the auditory is down at 19. There's too many of the ones that he heard.
This is a snapshot of the before and after of the CNS vital signs, which is a neurocognitive testing. And here we can see that he's had some improvements across training. And this is, with the neurofeedback and the light therapy. So his overall neurocognitive index there has improved. And especially his memory is looking quite a bit better, and his attention. We won't go through all those subtests, though.
Thank God.
Too many.
But it does show you the comprehensive evaluation you get with that CNS vital signs. And they can do it at home as well. You can do it in the office, or they can do it at home with a comfortable, computer they're comfortable on.
Mm-hmm. And this is another software that just showed the difference before and after training. And we can see an improvement in, he's had a deficit in alpha, and there's still a little bit of a deficit, but we can see an improvement there. We can also see a decrease in delta wave activity, looking more green after, and theta wave activity, still a little bit high there. And an improvement in phase, so looking a little bit more relaxed. So the results for case 2, when following the PBM, once we started a few of the sessions, the staff reported that there was no longer aggression within the training sessions, and there was a smoother transition in and out of the office, because transitions are quite challenging for most children on the autism spectrum, and things had really improved. Overall, reports from staff and parents were that he was calmer, and there was a good start to the school year. And he's going to continue to try to see further improvements with training.
So we typically do 40 sessions of training, but those on the spectrum, they typically take 80 to 100 sessions to really resolve the issues.
Mm-hmm. Our third case today is a complex case with ADHD as well as ASD traits and a lower IQ. And the primary difficulties are related to inattention and rumination, really getting stuck on things, stuck on thoughts, and not being able to move past them, as well as social difficulties. So in this case, we started with the regular single-channel neurofeedback training, and the progress was slower than usual. And she did a brain map to take a look at what the brain waves looked like, and we could see that there was quite a low amplitude alpha pattern, as well as excess spindling beta. So we had encouraged nutrition consultation, and we decided to add PBM. So initially we started with increasing 9, then 10 hertz, and then 12 hertz. And we were doing 3 times a week of the PBM ahead of her regular neurofeedback training session. So again, we're implementing it in that same way. The alpha PBM was targeting more the midline to the occipital lobe, and the 12 hertz more global. And she completed 30 sessions of combining the near-infrared light with the neurofeedback training. And when she initially started the PBM, parents noted that she was seeming a little down, like seeming a little bit sad. And the teachers mentioned the same. And when we talked a little bit more about it, it turned out that what was happening was she was comparing herself to other children and comparing herself to her sister. And this is something she hadn't really been doing before. So she was sort of noticing now that she was a little bit different from her peers. And we, together with parents, felt that this was moving in the right direction. So we wanted to add in some more social skills as far as the strategies we were working on, but we continued the training. So she has not yet completed full testing, but parents have now reported that she had a smooth transition into the school year in the fall, and that she's been really feeling a lot more positive about school, and before it was quite negative. And she's really noticing more around her and having improved a comprehension of social situations. So really noticing how her social skills kind of work at school. And we did a pre and post map on her using the iMediSync, and we can see here that her overall amplitude has really improved. So this was the before this was before iSyncwave and the near-infrared therapy. We could see that she had quite a low amplitude, especially just really across the board there. And then after, we're seeing an elevation. And case 4, so this is our final case, was an adult female with attention difficulties, as well as some difficulties with anxiety and mood regulation. A student, so a high-performing person, who was also working on tapering off some medication. The training plan had been to combine single-channel guided neurofeedback training with heart rate variability and Loretta neurofeedback. In this case, instead of providing the photobiomodulation right before each session, we were doing near-infrared light 2 to 4 times a week, but not necessarily right before the training. So it was a little bit of a different setup or protocol. She did a total of 25 sessions of photobiomodulation. She did initially sessions at 10 hertz from the midline back, and then 11 hertz and 12 hertz more recently were global. And this is a picture of her before and after eyes open iSync map. And we can see an improvement in her theta, as well as an elevation in her alpha on the brain map, and a bit of a decrease in her beta 3. This is a look at the theta-beta ratios and how they changed following the near-infrared light and neurofeedback, both the Loretta and single channel. And we can see a reduction in those theta to beta ratios. So that looks really great. The theta to beta had come down, theta over beta 2 as well, and theta over alpha.
And if you notice the location there, that left frontal, remember that left frontal activation has to do with positive feelings and approach behavior. So if you've got theta in that location, it means it goes along with depression, because you're less likely to be outgoing and focus on positive thoughts. So you can see that really has improved, and this is despite her weaning off an antidepressant. Mm-hmm. So that to me is the most interesting finding on this particular set of theta-beta ratios, is that left frontal becoming more active.
Well,
this one's a little bit small to see, but this is another iMediSync or iSync brain report on heart rate variability. And here we can see where she was before starting the near-infrared light and after. And the top one shows that she was a little bit more in the sympathetic overdrive, and now moving post-training, moving more towards a balanced nervous system. With the HRV analysis, there's also an HRV measurement 2D analysis here that puts it on a normative graph. And you can see that she's moving more from the overload side of things, more towards the excellent, which is great with her improved heart rate variability. And she was combining the heart rate variability training with the neurofeedback as well. And we can also see this is another iSync brain report there with the HRV analysis, and it gives you the 5 stages of stress and shows that before she started there, she was more in the alarm state. And now she's moved more towards the homeostasis state, indicating a calmer nervous system. So our preliminary thoughts working with the near-infrared light is that we're quite happy with how it can be integrated into the neurofeedback program by adding it in right before each session to help kind of ease clients in. Our preliminary findings are looking like there's been improvements or even enhancement of our training. And we're also happy to be using it to help speed improvement. We're hoping that that's going to be something that can be continued to be integrated into our training programs.
So remember that research on light therapy shows that it gets results, but the results don't necessarily last. So for example, there's a researcher in Boston who has been using it with veterans who've had post-concussion syndrome, and they continue to use it, and they check in with her, and they're using V-light equipment, but it's not something that lasts. However, if you do it and follow it with neurofeedback, we know that when you get neurofeedback changes, they do last. So if we can speed up our neurofeedback, get those neurons that fire together to wire together, then we feel we will get lasting results. Okay, so are we ready for questions?
I think we're ready for questions.
Okay, here they come. Thank you. Thank you for just like putting things so organized and making it doable. That's always been a takeaway that I've had whenever I listen to you. I'm like, oh, there's so much, and then it's doable. So questions?
Speaking of that doable, the helmet is a little bit heavy. So we haven't tried using it for photobiomodulation and then the EEG neurofeedback, the EEG biofeedback. One of the clients, for example, has scoliosis, so keeping it on more than 10 minutes might not be so comfortable for her neck and back, but it's certainly fine for doing the assessment. Like anybody can tolerate that helmet for the assessment. And you may wonder, those complex cases of ASD, why weren't we doing 19-channel training? It's because these kids couldn't tolerate it with their tactile sensitivity. You couldn't put a regular cap on them, but they can sit with the helmet on them. Mm-hmm. So, so that doability, I should say, Angelica, is certainly possible.
Yeah, if I can also add, we just are releasing the cell of our iSyncwave, which is a lighter version of the iSyncwave. So we're trying to resolve that by offering a lighter version.
Terrific.
Great. Let's see. People are interested in knowing what devices you're using. So question about, how are you measuring the ERPs, and what are you using for the single channel training?
All right. So for the, so you saw some of the data there from on the ERPs, and it was from a company called Evoke Neuroscience in New York. A limitation for people using the Evoke Neuroscience equipment is they just sell to physicians. So it's equipment that's used a lot by anti-aging physicians in the U.S. who do an annual brain check, along with like your annual cardiac checkup. So a lot of people working in our field would not be eligible to buy that equipment, but it's quite lovely stuff.
For the single channel training, we're using the Thought Technology equipment with the Thompson suite that goes with that. And
yeah, we've been using that since the 1990s. It's extremely durable equipment. And what we like about it is that you combine the neurofeedback with the biofeedback. So the same instrument has input for your EEG, 2 EEG sensors, up to 2 EMG sensors, as well as your other psychophysiology, your heart rate and
and we
finger temperature.
It's quite fast to hook up and get set up for the HRV, so we can even do that heart rate variability while we're doing the iSyncwave or while we're putting on a 19-channel cap to really maximize our use of time.
Okay, and in regards to the nutritional consultation, something I think we're all recognizing as being more and more important, there's a question about the thinking behind the consult, given the low alpha. I guess clarification, was the consult related to the low alpha and the spindling beta, or how did you decide and how did you pursue it?
So this child has a lot of sensitivities, and had been seen by a nutrition specialist before, but it had been a long time ago. And with the excess amount of high beta, it seemed like the brain was a little bit unstable, as well as low amplitude, maybe perhaps a metabolic type issue. So we thought it might be best to make sure that she has an up-to-date, visit to a nutrition specialist and make sure that her diet is meeting all the criteria that she needs. And so that was really why we decided to do it at that point.
And we're fortunate that we have a woman who has a PhD in nutrition as well as being a registered dietitian, and we refer people to her. So you have to think about practicing within your practice parameters. So with all our clients, I recommend that they take a fish oil supplement, for example, and if it's an ADHD problem, a fish oil supplement at least 1,000 milligrams a day with a higher EPA than DHA. But beyond telling them to take fish oil and vitamin D3 on a daily basis, we refer on to this wonderful gal who's got the PhD and is published in nutrition. The microbiome is becoming a big thing these days. So when you do your intake interview, always ask about diet, sleep, exercise, and what supplements they're taking.
Can you address the idea of the flashing lights with the PBM helmet? Is it like stimulating to the eyes? Can visually sensitive people tolerate it?
The lights are actually coming from within the helmet onto the scalp, so clients aren't seeing the lights. So there's no issue with visual sensitivity at all.
Right. And there is actually no harm with light in these frequency ranges for the eyes. The only time you have to wear goggles is if you go from red light to infrared and then laser. So cold laser, which can be used for healing, then you have to wear goggles, but not for red light or infrared. But as Andrea said, you have none of this light coming to the eyes. But remember, there are other things, and we also, we combine a lot of things. So sometimes we use AVS, audio-visual stimulation, and we get equipment from Dave Seaver
At Mind Alive.
At Mind Alive for that, and that's something people can do at home.
And that one does have the light over the eyes, which is different.
So they do it with eyes closed, but there is definitely light going through to the eyes, and it's quite safe.
And can you address training gamma when working with autism? Kind of
We haven't done it.
It's just too difficult from our perspective to tease out from EMG for the young ones with autism. We have worked it with more optimal performance adults. And I think that's really where we've kept it, just because of the difficulty teasing it out from EMG.
Right. We have tried it with 2 adult clients who'd done their 40 sessions of neurofeedback and were feeling great and just had heard about it and wanted to try it. I remember one of them, a lovely gal who's also an osteopath and a massage therapist. She said after doing her gamma training, so we were training around 40 hertz to increase around 40 hertz. And she said, now I know, I get it, what those monks doing compassionate meditation are all about. She loved it. Yeah.
And even with her work, we had to look at a ratio of gamma to EMG just to make sure that we were truly enhancing gamma in the training, because it's tough to tease out.
It's tricky. Yeah.
I think you make a really good point. I see in the early training, people are really enthusiastic. Early training, like practitioner training, people are really enthusiastic and want to learn how to train gamma because that seems really cool. And I think the points you make are really important.
Right. You're talking about very low amplitudes, and you're talking about a range that is influenced a lot by your EMG.
Do you do the QEEG prior to the PBM? Do you feel like that's necessary?
We do. So we always run, we try to run our EEGs on multiple devices to get a look at multiple databases, but we've been running them all through using the iSyncwave through the iMediSync database. And we do them, if we can, on the other NeuroGuide as well as the Evoke Neuroscience. So we do quite a lot of testing. So as much data as we can get, but some of these young ones, as we said, they're not capable of sitting through a full 19-channel EEG assessment. So we'll do a smaller, shorter version.
Right. So those 2 cases reported today who were on the autism spectrum, we did not do regular 19-channel quantitative EEG with them because they couldn't have tolerated it, but they could tolerate the having the helmet on. Now with the adult, they had the 19-channel with the cap, with one instrument, a MITSAR data collection, and then the NeuroGuide interpretation, and also with a cap on the Evoke Neuroscience, and then the third one was the iMediSync. So there we had, could triangulate it. But that's an adult who can tolerate having a cap on.
And then we certainly want to guide all of our training parameters, including the near-infrared, on what the brain map looks like.
Right. You always make your training decisions based on your data collection and your comprehensive assessment. Not one size fits all.
I think that's wrapping up the questions. If anybody wants to put another one in. And I also, if you have someone with a swollen brain and lesions in the white matter from chronic Lyme, for instance, or mold, and a high toxin load, so a highly sensitive person for lots of reasons, would you expect the PBM helmet to be helpful? Would that be, I don't know that you can predict that, but would that be something you would consider, would be another way of asking them?
I would consider it if they were also doing some nutritional therapy, because you're not going to fix things that have a metabolic underpinning or some medical condition with neurofeedback. You can only augment, but they also have to have the metabolic problem treated medically or nutritionally. Yeah, we can't save the world with neurofeedback alone or with photobiomodulation alone.
Yeah, another good point.
Always combine the things, right? The multimodal has been our watchword from the beginning.
Yes.
And with ADHD, there are over 200 medical conditions that can mimic ADHD. So, when you ask about sleep, you ask if the kid snores, because there are cases where we told them to go and check check with their doctor if there are enlarged tonsils. And just taking out the tonsils can relieve the ADHD symptoms. If it was the, lack of oxygen during sleep that was causing the problem.
Exactly. All right. We're getting close to the end of this is recorded. You can watch it again. I want to encourage you, Andrea. It was delightful for me to hear you for the first time. The apple didn't fall far from the tree here. Lucky you, lucky us. And please, check out things. AAPB, Dr. Thompson is always presenting. She's around. And I think we're going to be seeing a lot more of Andrea as well.
And also, can I add, in terms of other things to look at? So this presentation was a conflict for me with attending the Massachusetts General Hospital grand rounds on photobiomodulation. So every Friday at noon, you can tune in at no cost, and anybody can sign up for it. The photobiomodulation grand rounds run by the Massachusetts General Hospital. So we're talking about Harvard here. So that's something that people might want to check out.
I would like to add, if you're interested in that grand rounds, we're in communication with Paulo Casano. So just shoot me an email, Rebecca@iMediSync.com. It's in the chat, and I can add you to that list. We also have other events on iMediSyncAmericas.com. If you go to our event tab, we have free webinars throughout the year.
Wonderful.
I believe they're recorded, right?
Yeah, and they are recorded. We have our YouTube channel, iMediSync Americas, if you search the YouTube, and that has several of our recordings there.
Well, Rebecca and everybody associated with iMediSync, thank you. I was trying to say two words at once. Thank you for bringing the ADD Center to us today and for everything that you're doing for NRBS. We're really appreciative of the relationship. Thanks, everybody, for joining. Have a good weekend. Good to see you all.
Bye. Fun. Thank you. Bye-bye.
Bye.